In a recent study conducted in Cook County, Illinois, 66% of those who said they had Medicaid CHIP, Children's Health Insurance Program, were denied appointments, compared with 11% who said they had private insurance. It is a sad fact that people with Medicaid are often turned down by medical providers, being told, "We don't take Medicaid." Yet the Obama administration plans to use the program to cover more and more people as part of ACA. In my experience, I have found that the Medicaid clinics are rife with abuses by administering facilities in both billing and lack of actual care. Knowing that this is a problem, what would you do to improve medical access and care?
I would have a nonprofit, single-payer, universal health care system, and I would pay for it with the solar hydrogen economy, where we replace oil and coal and the fracking of natural gas with hydrogen made from water, with electricity generated from wind and other cost-effective solar technologies. That would create over $2 trillion every year for the American people, which would more than cover the cost of a nonprofit healthcare system that would be based around preventative medicine. And a big part of the preventative medicine is, if you're on a hydrogen economy, your kids and the people, everybody in this country breathes polluted air that's loaded with poison. Gets into your blood, gets into your brain, gets into your organs, causes cancer, dementia, autism. That's what's creating these epidemics of healthcare costs. So if we have this shift to a solar hydrogen economy, and which would have organic, poison-free food, these massive explosions in healthcare costs would go away, because we wouldn't be poisoning our own people anymore. That's what's causing these big problems, is that you can't breathe the air. And it doesn't matter where you go in the country. I was up in Iowa in 100 miles of cornfields, and the air pollution was terrible because of the immense amounts of pesticides they spray for the corn, so that they can put it in the gas tanks of cars so that it can corrode your engines. And all because of lobbyists from the Arthur Daniels Midland Corporation can make money. This is what's wrong with the country, and the answer is very simple. You get the profit out of these critical areas like healthcare, education. That's another disaster. We're privatizing. We now have students going bankrupt and have lifelong debts, and getting a pathetic education in the process because we've chosen to privatize that too.
Okay. Andre, you have a minute and a half.
Sure.
2 minutes. Go ahead.
Could you please rephrase the question for me, so I just repeat it for me so I can hear it one more time?
Okay, basically we're saying that most medical clinics don't take Medicaid patients. And in my experience, I've found that Medicaid clinics are rife with abuses by the administering facilities in both billing and lack of actual care. So how would you take care of this problem, even though Obama thinks that he's going to use the Medicaid clinics to service ACA patients?
Right. At one point, I was making a lot less than I do now, a lot less, and I didn't have insurance. And for many years, I didn't have insurance. Yet I never went to an emergency room on taxpayer dollars. And I never once took government assistance for anything. What I did go to facilities called Medicus. Medicus is a program where doctors actually work there, and the cost is not quite as high, but you're still paying for your service, and you're paying for preventative measures. It's one of those things where you come in, you see them when you have the problem, and then they tell you how to get rid of it and how not to get into these things again. And it's that kind of environment that I think we need. But people still, we can't just say, well, we're going to have a government-run health program. I understand that a universal health care system would be great, but we don't have the funding for it right now. In time, yes, I would love to see a universal health care system, but we can't implement that right off the bat because, number one, we don't have the funding, and number two, we have a shortage of doctors to see everyone right at the moment, right at the same time. We don't have enough doctors in the field.
Okay, well, thank you, candidates, for answering these tough questions. about social programs and the Trans-Pacific Partnership. We will debate war and military on July 30th, so mark your calendars. To learn more about your choices in election 2012, including congressional candidates, visit rightindependent.org. From Los Angeles, California, this is Judy Frankel saying thank you and enjoy this summer day.